the presentation. So welcome everyone to the 2023 Research Symposium for our Collaborative Research Assistantship. We're excited to share the results and the research that these graduate students have been working on this summer. I'm Sarah Miller. I'm the programs coordinator for the Hennepin-University partnership. And in addition to our 7 wonderful students, I'm joined on the call today by Scott Vargo, who's the director of HUP. We're going to go ahead and get started in just a minute with our student presentations. First thing I wanted to do is to share very briefly what HUP is, in case you don't know, and a little bit more about this particular program. HUP has been around for about 20 years. It's a jointly funded partnership between the University of Minnesota and Hennepin County, and we support both of those institutions to work together to create positive community change, particularly through cross-sector collaborations, research, and generating new approaches through HUP mixers and other kinds of conversations that we help facilitate. And as part of that work, this is our 2nd year of doing the HUP Collaborative Research Assistantship, which is a summer program for 7 graduate students. And there are kind of 2 main components. The first is that each student is matched with a research project or evaluation project at Hennepin County that is directly related to the county strategic priorities, that is kind of real world research on often complex social challenges. The second component of the program is that the cohort of students meet together weekly and get to know each other, have conversations and reflection that's designed to kind of enrich their experience and deepen their learning. So since the end of May, these students have been working 20 hours a week on each of their projects, and we will hear about, they have about a week left, so this is kind of a almost done progress report from them. And I also just want to note before we move on that this program is funded by the Center for Urban and Regional Affairs, which is where HUP is housed in the university. So a big thank you to CURA for the funding for this program. With that, I will turn things over to our first presenter. The way that this will work is that the students will present for about 10 minutes. And then we'll have about 5 minutes at the end of those presentations for Q&A. If you look at the bottom of your Zoom window, you should see a Q&A button. So feel free at any point during the presentations to send in a question. Scott and I will be monitoring that. And once we get to the Q&A portion, we'll share as many questions as we can with the students to answer. And if you run into technical difficulties or anything, feel free to email us at hup@umn.edu. So with that, I want to turn things over to our first presenter, Anna Boken.
Hello, good morning, everyone. All right, is everyone able to see my screen?
I can see it.
Oh, you can't? Okay. Oh. Okay, there it is. Except I think this should be in presenter mode, actually. Oh, here we go. Everyone can still see it?
I have a loading screen right now, Anna.
Oh, okay, let me try one more time.
If you click the drop-down arrow next to that start slideshow, there should be an option to something about presenter mode.
Oh, okay. Here we go. That's funny, I just had it.
Yeah, we were seeing it before. There you go.
Okay, apologies for the slight delay. Okay, good morning, everyone. My name is Anna Boken, and I'm a sociology PhD candidate here at the University of Minnesota. And this summer I was interning with Hennepin County on their quantitative evaluation of the county's Guaranteed Basic Income, or GBI, pilot program. So it's been an amazing opportunity to work on such a cutting edge policy when there's increasingly more attention being paid to the area of economic supports and money being given directly to people. Okay, so a brief agenda, just to have the lay of the land. I'll first briefly describe what is a GBI pilot and some background to make sure everyone's caught up to speed. I'll then describe our plan for the quantitative evaluation. So I'll go into the research design as well as the data and outcome measures. And I'll wrap up with our plans for next steps or some deliverables and finish with the Q&A. So just to make sure we're all on the same page, I know not everyone here might be familiar with the concept of a GBI, which is actually slightly different from a UBI, or universal basic income. But GBI is defined as regularly paid cash transfers, usually from the government to an eligible group. And the eligible group can mean a lot of different things. This can be determined by income, geography, zip code. There are even specific programs tailored at foster youth, pregnant women. So these policies are all being designed with different groups in mind. And the main goal is to address poverty, to reduce income inequality, and to promote economic mobility. Other core tenets of a GBI include simplifying existing social safety net systems. So in other words, this means reducing administrative burden and in a way collapsing all different programs into one to sort of create as much of a frictionless system of getting money to people as much as possible. It can also serve as a cushion against economic disruptions. So for example, we saw stimulus checks being delivered during the COVID-19 pandemic, as well as disruptions due to automation, technological change, and other areas. And finally, a GBI can promote empowerment, choice, and autonomy in decision-making. So when you give money just to people directly, we trust that they'll be able to use the money as they see fit to serve their needs the best. On the other hand, there are some concerns about both with GBI and UBIs about its affordability, straining government budgets. Economists will always point to potential work disincentives, as well as the interplay with existing benefits, which is an area of important research at the moment. So the task this summer and going to the fall is to evaluate the Hennepin County GBI pilot. And first of all, why evaluate these pilots? So people, including myself, believe that money given to people is great no matter what. But at the same time, what we're doing can serve as a proof of concept for GBI as a policy tool. So as I mentioned, there are many GBI pilots, both in the US and around the world. So the methodology and results of our evaluation can be applicable to others. We can document what we're learning in terms of the design and implementing the GBI that might be of use to other governments, nonprofits, and other organizations thinking about introducing a GBI. And finally, we also can shift the public narrative around the deservedness of social safety net benefits. So thank you to Alyssa Erickson, a colleague at Hennepin County. So here, in terms of our actual evaluation methods, as many of you know, originally, we did plan to do a randomized control trial, or an RCT, and this is mirroring a concurrent GBI pilot that the city of Minneapolis is piloting with the Federal Reserve. However, due to some changes in our research design, we are now focusing on this descriptive section here. So we'll be doing a comparative analysis, some correlational analysis, and surveys, which I'll just get into a little bit more in a second. And this is all part of the umbrella of the quantitative evaluation. So to zoom out a little bit and give a bird's eye view, this is a work in progress as well, but our research question, sort of one way that we're thinking about it, is the GBI better than other economic supports, such as temporary assistance to needy families, in supporting families' economic well-being? And we will be using a mixed methods empirical strategy. So this is two-pronged. It is quantitative and qualitative. The quantitative evaluation is being done by Hennepin County, the Hennepin-University partnership, so my role, and also SHADAC, or the State Health Access Data Assistance Center, who will be assisting with medical claims data. And essentially, we'll be estimating the change in outcomes for the treatment and control group, And I put control in quotes because I will elaborate on that in just a moment in the next slide. And also we are doing a qualitative evaluation. I won't go into that too much, but we are partnering with the Improve group to conduct surveys, interviews, and focus groups. And sort of the whole goal here is to see what meaningful changes are happening to people who are getting the money. So compared to people, yes. So in terms of the actual design, there's a lot of changes. This is all sort of happening as we speak as well. Just last month in July, Hennepin County invited eligible families to participate. As of this month, we are verifying their eligibility. Families are agreeing to opt in. And starting this fall, about 200 families will get $500 a month for 12 months, plus 3 months of a taper period for a total of 15 months. As for the control group, so this is also an area right now that we are focusing on. We are in the process of deciding on a pseudo comparison group of families that meet the eligibility criteria, but might slightly differ on some parameters. And in terms of the eligibility, in terms of time, I might not go into this all very specifically, but we have some criteria, and this has shifted over the summer. But essentially, we are looking at families who have an active SNAP case as of May 2023, at least one adult aged 18 or over in the applicant role, at least one child under the age of 5. We also ask that no household members are on the Minnesota Family Investment Program, or MFIP, or the Diversionary Work Program. We also consider households that have applied for an emergency program, such as emergency assistance or emergency general assistance, between November and May 2023, that the household income is less than 100% of the federal poverty guidelines, and that the household has earned income. Moving on to data and outcome measures, the data we are using is administrative data from Hennepin County, which is used to determine eligibility for public assistance and healthcare, internally known as MAXIS. And the potential outcomes, this is also an area right now that we are still deliberating on, but reading up on the literature and what other GBI pilots are doing, we've identified a few key areas of potential outcomes. So housing, financial security, employment, well-being, and health. This is an active area of interest right now, and we are working to operationalize these measures, maybe combine and form indices as well, which is something we've seen in other GBI pilots. But basically, the general guiding question is, how does the GBI support families' economic well-being? What's unique about our pilot here with Hennepin County? So we're most likely the first county to administer a GBI pilot. These are mostly conducted by cities or nonprofit organizations. We're one of the first to taper, which means that we have decreasing payments in the last 3 months of the pilot. This next one is interesting, but our pilot actually raises awareness of how to effectively use something like GBI. So in the letter we send out to recipients, we also have a little blurb specifying how this will interact with your already existing benefits like SNAP. We also have identified that we can potentially link our administrative data with another administrative data set, also through the state of Minnesota, SLEDS, which is a linked education and employment data set to study longitudinal outcomes. So I encourage you to think of someone like Raj Chetty's work with intergenerational mobility. Perhaps that's something we can do. And also there's the potential to conduct follow-up studies. There's a sort of a dearth in the empirical literature of follow-up studies and long-term studies. Just a few key challenges. So we are anticipating survey attrition. This is something that other pilots have seen, especially the city of Minneapolis. I think they had, less than half of their control group participating for the whole duration of the pilot. So one solution is to compare recipients with similar demographic characteristics at baseline. Not perfect, but maybe something. We are also grappling with small sample sizes due to funding constraints. This can complicate meaningful analysis of subgroups. We also cannot design a long-term study, also due to funding constraints. A lot of these pilots are being funded by federal relief aid or FERPA, so the money has to be spent by a certain amount of time. And a challenge is to also accurately measure and assess how GBI is interacting with existing social safety net programs. And I think this is almost the last slide. Some other considerations with these pilots is just measuring. How can we accurately measure any effects? It could be that something like a GBI is creating potential for future effects, but they may not get picked up in the data until later. So this is called a sleeper effect. In sociology, we have a concept called cumulative advantage or disadvantage, where effects can build over time. So this is something a short-term study won't capture effectively. We are also cognizant and careful to think about impacts on the individual, communal, peer, and societal levels. So something like an RCT is likely to miss some of these community or peer effects, such, for example, sharing the money between households and family members on a non-random basis. And to wrap up, because I think I'm right at time, some of our next steps with my colleagues at Hennepin County is to generate a logic model of our research design. So a visualization capturing all of our outcome measures and approach. I'll be working on an R Markdown document detailing the data analysis steps using our administrative data. We will present and deliver reports to the county. It would also be great to post our evaluation plan and survey on the county's website for transparency and public access, as well as writing articles for the popular press, since this is an area of increasing interest. And I wouldn't be an academic until I also mentioned eventual submission to an academic journal. So thank you, everyone, and I look forward to your questions and comments.
Thanks so much, Anna. Wonderful, wonderful report from you. For folks that maybe joined a little late, just a reminder that you can use the Q&A button at the bottom of your Zoom screen to submit any questions that you have for Anna.
And I'll say also one more thing for the Q&A is that the name of this program has changed also over time. So originally we called it a GBI, or a guaranteed basic income program, but with some changes in the methodology, it's now actually just more of a cash transfer. But I just still kept that GBI nomenclature because I know everyone here heard me talk about GBI for all of the summer, but it is now being called a cash transfer as part of the Raise the Baseline program with the county.
Thanks, Anna. We have a question from Michael Soto, who asks, Anna, I believe you said there was attrition. Why do participants stop participating, and what are they required to do to participate?
Yeah, so that's a great question. I think there's a lot to say. So the relationship the community might have with the county. So perhaps people don't see it worthwhile in their time to continue participating, especially if they're not in the treatment group or the group receiving $500 a month. I think we also have to keep in mind that at the end of the day, we're dealing with people who might be in crisis or a disadvantaged population. So it can feel perhaps extractive on some level to be asking of this data when people are not actually receiving the money. So those are some of the reasons. I think our pilot has gotten better in terms of how we're communicating with people, email, phones, all sorts of things. We did snail mail letters initially, but I think just making sure that we have a good basis for contact, communication, and respect with the community and the county.
Thank you. We have about a minute left for questions. I'm seeing some really great ones in here. So Anna, what has been the most challenging or rewarding about this experience versus academic only types of research?
Oh, that's such a great question. It's like the golden question. Okay, well, for me personally, so far, it's been so cool to see the interplay with government, but also together we're working with researchers at the University of Minnesota. So kind of all of us putting our heads together and trying to create a policy that we can meaningfully measure and that will have a positive impact on communities. This is also the part of research that I enjoy, is all these little methodological decisions. I once heard someone describe it as like forks in the road or a garden of forks where we have to deliberate and, you know, document, make sure all these decisions make sense, and be sensitive to people. And this is an actual policy. The money has already gone out. So it's important to keep that in mind, that it's not just something we can go back later and maybe change. It's a lot of quick, more thinking on our feet, and just, yeah, so it's been great.
Thanks, Anna. We weren't able to get to all the questions, but Anna's email is on that slide. So if you'd like to be in touch with her, I'm sure she would be willing to share more details with you. Thanks, Anna.
Yes.
So our next presentation is from Sam.
Can you see my screen? Yeah. Okay. Hi, my name is Sam. I'm getting my master's in science, technology, and environmental policy. And the project I was working on this summer is about expanding access to weatherization. So first, what is weatherization? It's both mechanical measures and building envelope measures that are meant to increase the energy efficiency of homes. So things like air sealing, adding insulation, repairing or replacing water heaters. And then in addition to these more physical measures, it's also health and safety measures. So measuring indoor air quality and adding ventilation if necessary, addressing some mold and moisture issues, etc. And benefits to residents. So there's improved health and thermal comfort for residents, as well as energy savings resulting in lower bills. And then I'll talk about this more later, but a lot of the weatherization that's done currently is for income qualified residents. So they're getting these upgrades for free and they're getting new appliances and just these improvements and they don't have to pay for it. And then the terms of the history of weatherization. So the Department of Energy, DOE, started offering the Weatherization Assistance Program, or WAP, in 1976. And that's funding weatherization for income qualified households. Some project background. So this is actually working jointly across the Housing and Economic Development Department, where I'm supervised by Mike Jensen, and the Climate and Resiliency Department, where I'm supervised by Jessica Spanswick. HED is involved primarily because they're already working to address some health and safety issues in homes, particularly through the lead hazard reduction program. And I just want to be able to provide the most comprehensive suite of health and safety improvements possible for residents. And on the climate and resiliency side, expanding access to weatherization fits well with Hennepin County's climate action plan that was published in 2021. There's kind of three major goals of this project. So the first is to figure out who's already working on weatherization, both the funding and the implementation in Hennepin County. And to do this, we talked to most of the major players in Hennepin County. So we talked to both utilities, Xcel Energy and Centerpoint Energy. We talked to the Minnesota Department of Commerce, who's very involved with the funding on the state level to different service providers across Minnesota. We talked to Sustainable Resources Center, SRC, and they do all of the weatherization on the low income side for Hennepin County. And then we talked to Center for Energy and Environment, CEE, who does all of the home energy squad, which I'll talk about more later. And once we had a better idea of this landscape, our next challenge was figuring out how to make it accessible for both Hennepin County staff and residents. And that's something that's still in progress. And I'll talk more about that later. And then the next part of it was, once we understand this landscape, figuring out where are there gaps that Hennepin County through HED might be able to address by expanding to offer weatherization. And that was done through these conversations, and then also looking at reports and analyses that have been done on weatherization locally already. And then the last goal was more on the climate and resiliency side, and that was looking at what is the overarching goal for, what role should Hennepin County play as this overarching centralized energy coordinator for cities across its jurisdiction. And that was supposed to be a lit review, but quite hard to find information at the county level for energy planning. A lot of it's been done at the city and state level, but very little has been done at the county level, at least in the US. And so this is just a very quick, rough first draft of kind of these options, so you have some sense of what's going on. This is what the utility is referred to as the income qualified market segment. And so as you can see, for the federal WAP program, which I mentioned earlier, and then both Xcel and Centerpoint, they all have different income criteria, which makes it quite confusing. And this is all for these extensive upgrades that I mentioned on that first slide that are free for residents. Residents who are getting weatherization aren't necessarily seeing all this complicated criteria. That's all kind of done behind the scenes by SRC when they're braiding these funds together, but it's still just something to keep in mind. And one thing to mention, in Hennepin County, you can only access the weatherization assistance program by going through the energy assistance program, which is short-term relief for energy bills rather than this long-term savings on energy bills. And then this is what the utilities refer to as the market rate side. So both CenterPoint and Excel offer rebates for things like adding insulation or air sealing or appliance upgrades, where you have to work with certified contractors, but then they'll give you tax rebates for a certain percentage up to an upper cap for adding insulation or air sealing, but you have to have like a pretty low level of insulation to start out with and then go to like the quite high level in order to get these rebates. And then all households in Hennepin County are eligible for energy audits through CEE's Home Energy Savings Program. And an energy audit is kind of an analysis of your existing energy usage. It looks at where air is coming in and out of your home. They use some infrared technology to figure out your existing insulation. And then CEE will recommend either these more minor measures, which they'll do on that day, things like changing your light bulbs or installing weather stripping. But then if your house needs more extensive work, if you're qualified based on those income criteria I just showed, they'll send you to SRC. And if you're not qualified for those, they'll give you some options. They have low or zero interest in loans for financing, and they can connect you directly to contractors and work on scheduling with residents. So from our conversations, there's very little comprehensive materials that lay out all of these different options for residents. That could be something that Hennepin County could provide. We're still figuring out exactly what that'll look like. One option is to take these different aspects of eligibility criteria, so income, household size, location, utility provider, and kind of make something that people could fill out as a website that'll give you like very tailored options, in addition to a more worksheet type thing that you could hand out to residents. One thing to consider is that utilities will definitely be changing some of their offerings and criteria in 2024 with their new round of triennial SIP planning. And then there's also state and federal funding that will be changing too. And some of that's not quite determined what exactly it will look like. So the question is just how much time and resources should the county put in now if it's going to be changing shortly, and will it be confusing for residents to have multiple versions of the same thing? I do think something to keep in mind is that Hennepin County, as I mentioned, the utilities kind of have their own programs and they have resources for the public about their own programs, but there's nothing really that's overlapping with all of the different options. So that could be one role for Hennepin County. And then in these conversations we also asked everybody, like, what do you think Hennepin County should be doing? What's their role? And the utilities were especially excited to think about opportunities to go through Hennepin County and just have different ways to reach residents rather than just through bills or emails that they're already sending out. The research that Excel has done locally in Minnesota, as well as a lot of the academic literature, has shown that word of mouth and working with trusted messengers is a really effective way, both to increase awareness of weatherization, but then to get residents to also actually follow through and do the whole weatherization process. And then one thing to keep in mind is that the DOE funding is quite restrictive on what you can do with it, what has to happen, whereas this utility funding is a lot more flexible. And while the funding that would be needed for HCD to expand to offer weatherization isn't yet set, anything will likely be more flexible than the DOE funding. So there's an opportunity to potentially partner with utilities and especially work on serving those who are above this like income cutoff, but still not easily able to afford weatherization, but would receive benefit from it. And then in our conversations, we also heard about Hennepin County potentially serving as a convener and just trying to get all these different people working on weatherization to meet and communicate regularly just to make sure they know what's happening across the county. So as I mentioned, we're still working with the Hennepin County Communications to figure out how to best convey this information to residents. I think it'll be really important to continue the conversations and the context we made with these different people working on weatherization to figure out how Hennepin County can best complement the work that's already going on. And then I'll be writing a report on the literature review I did. I did also a rough like cost benefit analysis of weatherization based on a lot of the existing research that's out there, and then some additional reports of weatherization locally. So there's a few remaining questions. So the first is, how will the new criteria for utilities on their income qualified programs, as well as this influx of state and federal funding, impact the current gaps in access to weatherization among Hennepin County residents? And the second is, we heard a lot about barriers and impacts to residents that weren't related to funding. So things like a workforce shortage for qualified employees that are used to doing weatherization related work. So SRC, who does all of the income qualified weatherization in Hennepin County, their deferral rate is up to 50%, which is households that are otherwise qualified, but the physical structure of the buildings make it so that it's unsafe for contractors to do this work. So things like if they have an inaccessible crawl space, or vermiculite insulation, which is assumed to contain asbestos, if that's in the house, that has to be remediated first before actually moving on to the weatherization. And that can be really difficult for SRC to address. And that's actually where some of the state funding that was passed in this last legislative session is aimed or targeted at addressing those deferrals. And then there's also this lack of awareness, like I mentioned. And then weatherization itself is kind of a multi-phase, lengthy process that can be really disruptive for residents, and that can be a barrier to some doing that. And there's also a concern that for weatherization, especially for renters, it can potentially increase prices following weatherization. And while there's some attempt to get property owners to sign contracts that they won't raise prices, it's hard to make those like legally binding. So that's definitely a real concern for residents. And then just some reflections. So I think this uncertainty in future funding made it both more exciting to figure out like what will weatherization look like, but also a bit more challenging to figure out where Hennepin County fits in. This summer, I really enjoyed both seeing and reading more of the academic research, but also getting to talk to a lot of different people and figure out what they were working on in weatherization locally. And then the cost benefit side, which I didn't talk about much, but I was really surprised at the non-energy benefits. So things related to health and safety, there's actually generally a larger return on investment there than on the energy side. So yeah, thank you.
Thanks, Sam. We have a question. What do you see as the biggest or more realistic opportunity for the county to expand access to weatherization in terms of funding or partnerships or other avenues?
So with weatherization, the biggest savings in a cold climate like Minnesota is actually on the heating side. So Centerpoint, when we talked to them, we learned about some of the expansion that they're hoping to do on this like low to moderate income area that I mentioned that's kind of above this income cutoff, but they're not easily able to afford all of these upgrades themselves. And they seemed really excited to partner with Hennepin County. So I think that would be a great place to start, as well as some of these deferrals and addressing the health and safety requirements that SRC is having trouble with, that Hennepin County and the work they're doing and the expertise they have might be better suited to work on.
Thanks so much, Sam. Fantastic work. We're going to move on to our next presentation, which is, let me make sure I have this right, Jack. Yeah.
All right, can everyone see that presentation? Okay, great. Hi, so my name is Jack Gramlich. I'm an intern this summer with the HUP cohort with the Integrated Data and Analytics team at the county, and I'm a public policy master's student at the Humphrey. All right, so this summer I've been working with Susan Lee Reif and Tracy Bibelnix on the IDA team. My task has been to develop a proof of concept for results-focused investment. Results-focused investment has to do with gathering data-informed insights about programs that are particularly effective in ways that measurably improve conditions for residents. At this point, we are working to build out a framework for how that data work can happen. And just generally, this is not intended as a final plan, but rather as the start of a conversation. One thing that I want to highlight here is that our team takes as a starting point the assumption that county programs are working. So for example, a nutrition program like SNAP plays a vital role for survival, and our work does not involve trying to assess whether or not that's happening. Rather, our goal is to try to identify spillover benefits. Results-focused investment is about trying to find those programs that do a particularly good job of helping residents, sometimes over and above intended goals. I'll be getting more into this idea of spillover benefits later on. So this slide gives some specifics on the process that we followed to develop our concept for results-focused investment. In the crosswalking phase, I drew connections between county data and some metrics of program impact. For these metrics, we drew from the Constellation Fund, which is an organization that has the goal of connecting the dots in the fight against poverty in the Twin Cities. The Constellation Fund's metrics book includes a lot of research-based formulas to estimate long-term benefits from hundreds of different types of programs. This slide on the left has an example from our crosswalking process. So the county has data on preschool assistance for county clients. We identified a connection between that data and the Constellation Fund's metric EDU-001, which can be used to estimate the effect of early childhood education on lifetime earnings. So by matching up that metric and that indicator from the county, it's possible to create an estimate of the effects of preschool on lifetime earnings for those county clients. We went through and identified a list of similar areas of alignment between county data and the Constellation Fund's metrics book. Next, after the crosswalking process, we selected our area of focus for the proof of concept. A key insight was that most metrics focused on one of two key outcomes, which were quality adjusted life years and lifetime earnings. Both of those outcomes cut across domains, but lifetime earnings had the advantage of being relatively intuitive. So for example, if a program leads to an increase of $100,000 in estimated lifetime earnings, it's pretty easy to imagine what kind of a difference that would make in the life of a typical county resident. So because of that, we decided to focus our proof of concept around the idea of like what programs affect lifetime earnings the most. This slide we call our complex web. So the idea is to illustrate the many connections between policy domains, metrics of program impact, and then different types of long-term benefits for residents. The middle column here shows some of those research-based metrics from the Constellation Fund. The top blue box there is the same metric from the previous slide, EDU-001, which can be used to connect early childhood education programs with increases in lifetime earnings. As you can see, some of these metrics draw implicit connections across domains, such as by linking housing with income. And some programs like food distribution could be measured with multiple metrics depending on the outcome of interest. Quality adjusted life years or lifetime earnings are one of the other ones not represented here. So I spent about 4 weeks of this summer on an in-depth literature review, and this lit review guided my work developing the proof of concept for results-focused investment. I'm not going to go into detail on all of the sources or the inclusion criteria. My plan today is just to highlight some top-level takeaways. So first, a key priority in this kind of system is to involve stakeholders in data strategies. One key point is that program staff have contextual knowledge of what data points matter and how much to rely on one variable versus another. And also residents have situated knowledge of the priorities and challenges in their communities. Second, there are opportunities to measure how upstream programs relate to downstream benefits. So for example, governments might not be able to directly measure lifetime earnings, but you would be able to measure like how many of the students who matriculate to community college go on to earn a four-year degree. There are also opportunities to measure spillover benefits, to present evidence-based insights on how programs change conditions for residents far down the line from the program's immediate effects. So that would be like an example there would be to look at how different types of educational support programs like tutoring or after-school activities affect lifetime earnings. And then a last takeaway from the lit review is that transparency around program data and resident outcomes can provide opportunities for grassroots advocacy and help build public trust in the accountability of government services to community goals like disparity reduction. All right, after the lit review, I created this logic model, which shows an overview of a overall system for results-focused investment. I'm not planning to go through all the different boxes here, so I would invite you not to squint, but I'm just going to describe the big picture of the RFI system. So this logic model shows how inputs like staff time, research-based evidence, et cetera, feed into work to analyze data and produce research outputs. These outputs would be intended to spark conversations around programs with particularly strong spillover benefits. The hope is that research products would help stakeholders develop new knowledge, allowing for changes in behavior, such as increasing certain investments, which would then improve conditions for residents. You'll note that this chart is drawn as a cycle. The idea is that new decisions could lead to new conditions, which could then be measured, leading to new program data, which could then be brought together with up-to-date evidence on program impacts, starting the cycle again. So over time, results-focused investment could become a virtuous cycle of continuous improvement. Now at this point, I want to flag that the next 3 slides are a mock-up of a dashboard for results-focused investment, and that dashboard is intended to fill in the picture of the right-hand side of the logic model. So my goal is to show how outputs like data tools could build knowledge and connect to decisions, like decisions to increase investments that have the aim of reducing disparities. Research projects like that dashboard would not be intended to just like stand alone, but it would be intended to fit into bigger picture organizational processes like budgetary decisions. And then also just a note for the dashboard slides, I'm going to be clicking through pretty quickly. So again, please try not to squint too much at the small text. All right, so this is the homepage of the proposed dashboard. It gives a brief overview, some instructions for how to access data. This kind of dashboard could be created via Power BI or something like that. This is an example of a program detail page where a user could select a program via a drop-down menu and get a sense of some stats on how the program connects with lifetime earnings. So here we have a program detail page for pre-kindergarten. So our team pulled together summary data on program participation from the MDE and from internal county data tools. I then applied Constellation Fund metrics to estimate the effects on lifetime earnings based on pre-K participation in Hennepin County. The estimates here are based on that work. We can see that the benefit cost ratio is 3.95, indicating that the long-term benefit in terms of lifetime earnings is about 4 times higher than the estimated costs. The dashboard also includes options to display disparities via charts that separate out benefits by race, sex, commissioner district, and other groupings. All right, this is the last page of the proposed dashboard. The format is inspired by a table published by the Washington State Institute of Public Policy. And those interested in learning more could check out that resource. I have the link if anyone would like it. The table generally is supposed to show a 30,000-foot view of how different programs affect lifetime earnings. I want to emphasize again that the focus here is on that long-term benefit. So bringing back the example of SNAP from before, nutritional assistance affects not only survival, but also longer-term outcomes. And here we're just looking at benefits in terms of lifetime earnings, not in terms of all the other benefits that could be quantified. In the second row of the table, we can see that the focus is on SNAP benefits for children under 5 in the county. The estimated effect on lifetime earnings per participant is about $2,500, and the benefit cost ratio is about 1.8, indicating that the estimated increase in lifetime earnings is higher than the estimated costs. And this table presents the same key stats across programs. The idea is that this could kind of be built up with a lot of different program data. All right, well, a few top-level reflections from going through this work. First, focusing on outcomes is a big opportunity. So programs in different areas can be measured in terms of goals like increased lifetime earnings for residents. Second, spillover benefits are important and possible to quantify in at least some cases. We have an opportunity to gather information on programs that might be extra effective, bringing benefits over and above their primary purpose. Identifying those programs with big spillover benefits could help inform decision-making about where to increase investment. Next, data tools that focus on outcomes can track disparities between groups and changes over time. That kind of data could be really useful to assess progress toward disparity reduction goals. And last, RFI data tools could serve the additional purpose of promoting transparency to build public trust. At this point, I want to say thank you so much. I had a great experience working at the county, and I want to thank Tracy and Susan from the IDA team, everyone I've crossed paths with at the county who's here today, Scott and Sarah and the whole HUP cohort. Thanks everyone for the opportunity to learn about the county and dig into some applied research. At this point, I'd like to open it up for questions.
Thanks, Jack. We have a couple questions. How are the mappings, so like indicator to metric, found in your work?
Yeah, so how are the mappings found in my work? So the Constellation Fund's metrics go into detail on like what data you need in order to calculate the estimated benefits. So for each calculation, there's kind of a page that shows, you need the number of participants and you need like the estimate of how long each participant spent on the program and that kind of thing. And so what I did is I took that information on the metrics and connected it with a document that Susan from our team had put together, listing out different areas where the county had data. So it was kind of like a process of matching up, like, oh, we have data on preschool. Oh, and there's a metric on preschool. So that I just listed out all those metrics and connections.
Great. And then the next question is, this person's wondering how much attention you paid to the need to focus on what level of government benefits from what types of spillovers. So what types of spillovers especially result in benefits at the county level?
Yeah, that's a great question. And we did not reach that question of different levels of government benefiting from different levels of spillover. We were focused more on spillover benefits from the perspective of a county resident. So like a county resident's increased lifetime earnings. But yes, it sounds like it could be a good question to pursue in further work to look at, what the impact might be of like some benefit on county expenses. Like one thing we had talked about in this work was how like maybe investing in an early childhood program might reduce the likelihood of needing to pay for like the jail. And so that's a direct county cost that probably there's some relationship, but we would need to do additional research to quantify that.
Great. We have some time if there are other questions from the attendees or the panelists. I guess I'll ask a question, Jack, kind of more on a personal level. As you think about going forward in your own studies and learning, what are you taking away from this experience, and is it affecting kind of your long-term interests or plans for yourself?
Yeah. I mean, I would say I've had a general interest in kind of how governments can work to increase affordability and reduce like the big costs that families face in their budgets. And I think this work has helped me think about like some of the ways that government can be really specific about using data to kind of move the needle on those things. So, if we know that childcare is a really good investment that boosts lifetime earnings, then maybe there's kind of a like happy overlap between the goal of helping families not have to pay that expense and generally improving conditions for county residents.
Thank you. Thanks so much, Jack. Great work. We're going to move to our next presentation, which is from Denisha.
Okay. 1 second. Good morning. Can everyone see my screen?
Yes.
Perfect. Again, my name is Denisha Demerit. I am a student at the University of Minnesota, where I'm in the MPH program of epidemiology. And today I will be presenting on North Point's Health and Wellness Center Expansion Evaluation Project 2023. For today's agenda, I will begin by discussing the background, and then we will move into the research design, followed by some results of the study. And then briefly, we will discuss some of the limitations of this project. And then we will move on to the learning and key takeaways. And then we will end in some questions. So to begin, North Point Health and Wellness Center is a pillar of strength in the North Minneapolis community, primarily serving those who have been historically underrepresented and those who have been marginalized. North Point has been a legacy institution in the community for over 50 years, and its mission is to create a healthier community. And so in doing so, they have embarked on an extensive community development project, surpassing over $90 million with a multi-million-dollar investment from Hennepin County. And so this project is comprised of the renovation and the expansion of its facility to allow for greater space and to allow for greater fulfillment of the community's needs. And so the aim of this summer project was to evaluate the impact of the medical clinic's expansion on guest experience. And so with that, our research question was, how has the expansion of North Point's Health and Wellness Center's medical clinic impacted guest experience and access? And so we began with a qualitative method approach. We first looked at developing the interview protocol, and then we moved on to recruiting participants. And this was done by a street intercept strategy, which took on 2 approaches. The first approach was, as participants were exiting from their clinic appointments, they were asked by the researcher, myself, to participate in the study. The second approach was, as participants were waiting to be seen by their provider, they were given mini flyers in the waiting room and asked to stop over to the researcher station if they were interested in the study. And you can see to the bottom right, there is a image of what the researcher station looked like. We had some water bottles, we had some goodie bags filled with North Point swag. Next, we had participants give informed consent about audio recordings for the interview. And next, we conducted semi-structured interviews. These interviews were then transcribed, and these transcribed interviews were then inductively coded. Like I mentioned, 15 participants were interviewed and identified, and then a thematic analysis was conducted. From this data, 17 themes emerged, 10 of which were main themes, 7 were sub-themes, and 4 were major recurring themes. And these 4 major recurring themes were identified as they had more than 8 or more quotations from participants. And so for today's presentation, we're going to dive into the 4 major recurring themes, and they are as follows: accessibility, quality care, community importance, and appreciation of services. And so when we talk about accessibility, we are referring to the idea in this context that services being provided and are offered are easy for everyone to use or easy for everyone to gain access to. And this theme actually had about 5 sub-themes. And we see the quotes here displayed are related to accessibility in terms of scheduling an appointment or in terms of wait time. And so I'm going to read what one of our participants had said about scheduling an appointment. I had to see someone else today. That's not ideal. I want to see another doctor, but I'm going to have to make sure that I'm okay. It's kind of frustrating because I wanted to see my doctor. On the flip side, another person talks about accessibility in terms of wait times. And they say, my visit today was good. The wait wasn't as long. You used to have to wait longer to be seen. The next thing we're going to discuss is quality care. And in this context, we're referring to the concept that the healthcare provided is efficient and it's effective, that it's patient-centered, and that guests feel seen, they feel heard, they feel welcomed, they feel comfortable, and they feel safe. We have a participant here who says, the services are quicker, the space is more comfortable and bigger, and to me, the quality of service is better. The people here that's working have a better attitude. Another participant says, my doctor, I feel like he truly cares about me. The next thing we're going to discuss is community importance. And this refers to the idea that North Point plays a significant role in the lives of those in the community they serve. And here we see a participant who exclaims, I think the expansion is important to the community because it gives North Point the chance to offer more services and have more resources for people. Another participant notes, the community deserves this. And they're talking about the expansion and renovation of the facilities. And lastly, the theme of appreciation of services. This connotes the idea of gratitude and positive feelings guests who attend North Point feel towards North Point. And here we have a participant who says, I'm just impressed. I just thank God for this place. I'm so happy. I'm overwhelmed to see North Point that I used to come to be at this level. Another guest says, the services are better overall. And another participant notes, I like the staff and I like the services. Like I mentioned, we took on a qualitative method approach. And with this approach, there is a plethora of strengths, one of which is that we gain deep and insightful, rich data about guests' experience and their perceptions. However, on the flip side, there are some limitations to this qualitative method, one of which is the lack of generalizability. And so with our small sample size, the results to this study may not be completely representative of all those who attend North Point Health and Wellness Center. Another study limitation is time constraint. Time constraint in terms of being able to conduct data collection for an extended period of time, which also affected the sample size. and in turn, lack of generalizability of this study. And so moving on, we're going to discuss some of the learnings and takeaways that I experienced in this opportunity. I think for me, one of the challenging things about this project was just thinking through which research method would be most useful and provide the most insightful data for North Point, whether that was qualitative methods or quantitative methods. And ultimately, as you've seen today, we decided to take the qualitative route. What was exciting for me, however, was just being able to work in person, especially after exiting a pandemic or, working through that. It's been difficult. And so having the opportunity to work in person, engage with the wonderful staff at North Point, and even the community members, that has been one of the highlights of this experience for me. One of the things, however, that did surprise me was when conducting the interviews with the guests, they often mentioned that they had no comment or that they had little feedback when they were asked about what could be improved about North Point. Often guests said, everything has already been improved. This expansion has already, blew my mind. And so they had little feedback regarding further improvements. One thing that I am taking away from this experience is the increased knowledge about engaging with the community and the many connections that I've made during this project. I'm so grateful for my time here at North Point, and even just to be able to engage with community members. And so with that being said, I am looking forward to continuing my time here with North Point into the fall, and I am just so grateful about this upcoming opportunity as well. At this time, I want to open up the floor for any questions that you may have. And right before I get to that, I just want to say a huge thank you to my North Point family. Thank you for all of your support, and thank you for all of you at HUP and in my cohort. I also want to give a special acknowledgement to my project support and mentor, Ellen Johnson and Kay Adam. Thank you. We will now open up the floor for any questions.
Thanks so much, Tanisha. We have a couple questions. I might combine the first two because I think they're related. One person was asking if you could comment on the small sample size. Is it large and representative enough? And I know you mentioned that was part of the limitations. And then on the kind of a follow-up to that, what's your recommendation for North Point to continue to gather information on guest and patient experiences?
Yes. So to answer the first question about the sample size, typically research suggests that you want a minimum of 15, when you're doing like interviews, you want a minimum of 15, anywhere between 15 and 30 participants in the sense of like qualitative interviews to reach saturation. In this study particularly, I think although the sample size is small, the data gathered was robust because at one point we had reached saturation. We started to hear a lot of the same things over and over again. So when we would ask them about, well, how was your experience today? Or what was it like to check in? Or what was it like to schedule an appointment? After participant 5 or 6, then you start to hear some of the similar themes come up again. And I think that was played into the sample size. And even though it was a small sample size, I think we did reach a bit of saturation. Granted, it is a small number of people, but I think the data that we got was robust. And the second question about recommendation to gather further information on guest experience, I think just continuing on with interviews, whether that be one-on-one interviews or maybe focus groups, and that could be done annually or, twice a year, however, or whatever's in the capacity for North Point to do that. But I think just being able to sit with community members and allow them to be able to give their story and share their experiences will be helpful, not only for building trust with guests, but also for North Point to continue on their improvement and their expansion.
Thank you. We have a quick question. Does North Point use a Net Promoter Score? Is that something you're familiar with?
That's a good question. I am not 100% sure on that answer. During my time at North Point, I did not come across a Net Promoter Score. but that is something I can look into and get back to you with.
Thanks. Let's see. Did you ask about whether people plan to continue to come to North Point?
That is a great question. Many of the guests and participants who I interviewed at North Point had been attending North Point for years. And so years of attendance is actually one of the other themes, one of the 17 themes that I discussed earlier, but was not mentioned today. Participants have been coming to North Point for years. I spoke to one person who had been attending North Point for 47 years, and many of them have been attending since they were children. Their children attend, their grandchildren attend, their great-grandchildren attend North Point. I spoke to another participant who lives in East St. Paul, but drives all the way to North Minneapolis to receive their healthcare because they have so much trust and they appreciate the services offered at North Point. So yes, many people who don't even live in the community anymore, or who have, gone on with their lives, continue to come to North Point, and it's been a legacy institution, like I mentioned, for many years.
That's wonderful. Final question. Have you considered taking a quantitative approach to guest experience when you return to North Point in the fall as a way to layer more data?
Yes, that is a great question. Thank you. I do plan on working on some quantitative methods. We are looking into preparing or developing some sort of digital survey, or I think North Point has one in place, but we're going to see if we can revamp that and get that up on the ground and running to get some more quantitative data, get a little bit more demographic information too. But that is something we are looking forward to and hoping to do with more patient satisfaction sides of things. Yes.
Great. And anything else you want to share about the plans for your work this fall?
Yes, this fall, I will be continuing my work with North Point, which I am super excited about. Thank you again for that opportunity to HUP and to North Point. But I will be continuing my work with guest experience and patient satisfaction. So also I'll be looking at productivity. So I have some reports that were sent over to me with clinical and medical productivity from providers, and I'll be diving deep into those, doing a little bit more quantitative side of things. And yeah, that will be my work going into the fall as well.
Fantastic. Thanks so much, Tanisha. Wonderful work.
Thank you.
Our next presenter is Chris.
Okay, share my screen. Wonderful. Okay, can everyone see my slides?
Yes.
Great. Okay. Good morning, everyone. My name is Christopher Robertson. I am a PhD candidate in sociology here at the University of Minnesota. And today I plan to talk to you or speak with you about my summer research experience working on an evaluation of Hennepin Healthcare's Next Step program. So my research assistantship is sponsored by Hennepin Healthcare's Department of Surgery. My co-supervisors are Dr. Rachel Nygaard and Dr. Derek Lombard. And my summer research project brings together a number of internal and external county partners, including Hennepin County, Hennepin Healthcare, and the city of Minneapolis. Primarily, my summer project contributes to an ongoing evaluation of the Next Step program by the Improvement Group. And Next Step is a hospital-based violence intervention program that seeks to end cycles of violence by connecting individuals who have been hospitalized for traumatic violent injuries to community resources. And this brief video provides details of the program. Can you all hear the audio?
I was about to say I'm not getting the audio actually.
Okay, let's see if I can. should hopefully work now.
We don't have a lot of the barriers that other programs might have. My name is Larry Burgess. I'm here with Next Step. I am a case manager.
My name is Thea, and I'm a hospital responder with Next Step.
So Next Step is a program that is actually based out of 3 hospitals. We started here at HCMC. So what we do is anybody that is a victim of violence, no matter what race, creed, color, we are there to provide support. What we're able to do, we'll step in, get them signed up for the program and offer them resources that might benefit them.
We also provide emotional support. We visit the patient several times a day. We also provide counseling, trauma counseling.
We have programs that help with employment. We have programs that help get individuals back in school if they need to get in school. So not only are we making an impact right when they come to the hospital, but also when they leave the hospital, we're helping them set goals, helping keep them accountable, being able to make an impact on the individuals that we work with, and they're able to take that to their homes and have an even greater impact on the lives of people they encounter.
I am Minneapolis.
Okay. And so as you all saw, the many great things and the great work being done by the Next Step program, despite its promising approach, we do not know the extent that the Next Step program addresses community safety needs as they alluded to with regards to people going back and impacting their neighborhoods. And so much of my focus this summer has been towards assisting with planning and implementation of the evaluation of the Next Steps program's impact on community safety. A guiding research question, or the guiding research question, has been, how can Next Step address community safety concerns? This work is currently in its initial data collection stages. And what that means is that we have conducted a focus group with internal stakeholders, and we are intending or planning to do a Delphi survey of community advisor, or the program's community advisory board members in fall of this year. And so this picture here was taken at the internal focus group with Next Step leadership and employees. Each sheet of paper represents a question that participants felt should be answered or pursued in our evaluation. What I did here, or my role in contributing to this, I coded each of these questions for kind of common themes to understand how internal partners perceived the community's impact on community, or the program's community impact on community safety, and what questions we should seek to ask our community advisory board. And so, again, completed the focus group with internal stakeholders. I've conducted a literature review of the hospital-based violence intervention programs, and created a Delphi survey, at least a first initial draft, that will be asked to our community advisory board members in the fall. This diagram here shows the Delphi method that, in a sense, is very much so a applied focus group with experts. Generally, or basically, specifically what the structure is, we ask a small group of experts similar questions, or kind of repeated questions over or pertaining to a particular topic, in hopes that we'll be able to reach a form of consensus. So in this example, we will be asking folks about what they believe the community's primary safety concerns are, and kind of ways to address those. And so finally, or very, very quickly here, just to get through these learnings, the main challenge I encountered was translating my sociological training into medical service and applied settings. And so sociology really doesn't train us typically to produce research that leads to solution-oriented insights. And so many times I had to navigate and ask myself questions about, hey, does this theoretical framing that I'm using, is it going to be beneficial? Is it going to work? How are people who weren't sociologists for a living gonna receive that? I was excited by learning how to look at community violence, which is something that I study in my research program, how to look at that from a different lens, not as a sociologist or a criminologist, but as a as someone in the medical field may look at it, thinking about violence as something that can be prevented, as something that we can intervene in. And in a sense that I found that lens, that framing to be refreshing, as well as to inspire hope. Again, something that sociologists really don't do well. And what surprised me is just the interest in the value of evaluation and research. So many times in previous work, I often had the issue of like trying to convince people that, hey, research is something that we need in order to advocate for policy, to get better, what have you, but to work with folks who are just who welcome feedback and who welcome the opportunity to expand, to get better and expand the work that they're doing was, again, refreshing. And I'm going to, from this experience, taking away an appreciation for applied research and just the knowledge, the methodological knowledge of knowing how Delphi surveys and kind of qualitative applied research is conducted, and looking forward to, be it in academia or not, using that for my future career. And with that, thank you all for your time.
Thanks so much, Chris. Please use the Q&A button at the bottom of the screen if you have questions for Chris. I will kick us off and just ask, what I heard as kind of a major theme is this difference between kind of your prior research experience as a sociologist, a criminologist, and your experience this summer. I'm wondering about how you see yourself integrating those in the future, or if you're still kind of thinking through that. What are you kind of taking away from this experience, and how might it impact your research and work going forward?
I think I feel like it gave a lot of meaning to the work that I was doing, or to this work. It kind of was grounding in the sense of like, hey, this is having a real tangible impact on folks' lives, and we're actually addressing these problems instead of just writing about them. And so for me, I think I hope to pursue an academic job, and do the whole professor thing. And I feel as though it's caused me to look for jobs that call for that at least are jobs that are in departments. Some criminology departments are applied, as well as public health academic departments that have a practical applied component. Because I think for me, to keep the sanity for doing that career and staying with it and being motivated by it, I think I have to have something like this. And so I'm thankful for this opportunity, because it showed me oh, Chris, no, you need to be in you need to do something applied in order for this your career to actually have a meaning.
Thanks for sharing that. I have another question, but I want to pause and see if the panelists or Scott or any of our attendees have questions for Chris.
Can I ask a question?
Yeah.
So you had mentioned with the Delphi survey, the questions going to experts. So in this case, are experts community members, or are they people going through the Next Step program, or are they people on the academic side? Who are the experts in this?
So they're a mixture of folks who are in the folks who do who are in charge of community safety functions. So someone with, I believe, with the Hennepin County sheriff department, and then folks who are academics, focus on equity, and then there are also folks who focus on trauma. I think the goal is for the ongoing kind of evaluation, to have like folks who reach out to who interview or who have that evaluation speak to folks who are in the community, who have like backgrounds like that have experienced either traumatic injuries themselves or to loved ones. And so I think the community advisory board itself, I believe, has not yet met. And so I think it is like it still is kind of, I feel there's still, I believe there could be room for more folks to be added. So, but I think it's primarily folks who are we're experts in like community safety and equity.
Other questions? Okay, here's one. How has your experience with this project in an applied setting in a hospital shaped or informed your thinking about this area of your work more broadly?
I'd say that it has kind of expanded or enhanced my appreciation for the work that hospitals do. I don't know if anyone has been down to the HCMC like complex, like downtown. It's huge. It is huge, and it's like teaming with people, and you just like being in that space. You kind of realize just the amount of resources and kind of the amount of resources that are in a hospital that many of these institutions hold. And so for me, it kind of expanded my thinking about like, you know, when we think about safety and we think about reimagining, like that safety is something that many systems, many institutions are can contribute towards. And I think a program like Next Steps is a step in the right direction in terms of like, you know, looking at how these different institutions that we have that we don't think are typically partners in community safety, like they are, and they don't necessarily have to be, you know, partnered up with law enforcement or the criminal justice system to do that work. And so this expanded my thinking about like, hey, how can we find safety and like equity and in all things in a sense. So very so I have a real a greater appreciation for hospitals after this experience.
Thanks so much, Chris. We've got about a minute left, and I have one final question. This might be hard because you might be humble about this, but I'm interested in if you did find, I know you talked a lot about this experience kind of helping you as a sociologist. How do you think sociology, in your unique perspective, what do you think that brought that was maybe missing or wasn't there before?
I think sociology does a good job, like as we talk about like structural things. You know, I think it does a good job of kind of theorizing and thinking about how these different systems link to one another. And so, in a sense, saying like, hey, like, you know, this work that Next Step is doing is powerful and it's making a change. But I think sociology as like an academic discipline does a good job and kind of help me as well to kind of make the critique of like, this is great, but we have to keep in mind that there's more that needs to be done in terms of like actually addressing crime. And like that's that deeper rooted like structural analysis that, hey, if we're going to address crime, we think about housing and education and think about all these other things that are interlocking, and that you can't just just try to solve one system without addressing the other. I think sociology does a very good job with that. And that's kind of that's it. And I think I bring that into this work. I bring thinking about the deeper structural issues and like how we can, you know, chip at it, you know, through efforts like these. And so, so it actually, I feel as though I became a much better sociologist from this experience.
Thanks, Chris. Thanks for sharing. Wonderful work. We're going to move to our next presentation, which is from Sweta.
All right, can you see my slides? Awesome.
Yes.
Never sure if it works. Okay. But hello, everyone. I'm Sweta. Today I'll be talking about the Youth Substance Use Project, which is what I've been working on this summer. Just to give you a quick background, I have primarily been working with Mark and Laura from behavioral health. And what kind of got started on this project is that youth are disproportionately affected by the substance use epidemic. We know that research tells us that more than half of adolescents in the US have or recurrently use alcohol or other drugs. And this substance use is highest among adolescents aged 15 to 16. Something that's also concerning is that current services are not tailored to youth's needs and can be very challenging for them to access. The overall goal for this project was for us to kind of develop broad recommendations for future substance use services based on information from a research and policy review, doing community engagement with youth, families, and providers, and also kind of summarizing data from a school district survey that we did. And just to provide like a quick introduction to our research design, our research questions were mainly exploratory. We wanted to explore the primary challenges and gaps faced by youth and families in accessing substance use services. And we also wanted to identify best practices around services offered to develop recommendations for future services. As I mentioned earlier, our data collection kind of focused on 3 data points, which was to conduct a research and policy review. We also looked at findings from a school district environmental scan, which basically asked schools about like the key challenges that they're facing in their services and what other supports they needed. We also completed focus groups with youth, families, and providers. For our analysis, we took a more qualitative approach to analyzing the data, and we used thematic analysis. And all of the recommendations that I'll be making later on have been developed by kind of the triangulation of these 3 data points. For final products of this project, we knew that we wanted kind of a large master document, which would house all of the information that we found over the summer. And from that report, we would kind of create more tailored products for different stakeholders, like creating an infographic for youth and families, having a presentation for county leadership, and we kind of summarized our findings into 3 categories, which is primary challenges and gaps in services, and then youth and family perspectives from the focus groups that we conducted, and the school district feedback. I have a little figure to kind of describe the challenges and gaps that we found in youth SUD services, and this is basically synthesizing the information that we found in research and from the community engagement sessions. So we found that there are a lot of issues with accessibility. Services are often perceived as being inaccessible due to issues with insurance, stigma, long wait times, or just a lack of awareness around current supports. There's also a distinct lack of youth voice in services, and so services may not always feel very connected or relevant for youth. Service centers are also often perceived as being unsafe due to power imbalances between client and providers. We also found that there is a limited focus on intersectionality, especially when you consider how power, privilege, and oppression can intersect with different social identities, which can increase risk for substance use. There is also a huge lack of prevention-based services. And from what we heard in our community engagement sessions and what we saw in the literature, there is a huge need to have consistent preventive programming in schools and in community settings from a young age. In our community engagement sessions, our participants also talked about how having a very punitive approach to addressing substance use needs is creating a lot of anxiety around accessing barriers. And youth, I kind of divided the primary themes that we found into parent perspectives and youth perspectives. Parents talked a lot about having factual and more developmentally appropriate psychoeducation for youth. They also talked about utilizing storytelling with community members with lived experiences, and also working with youth to co-create these services and supports, and taking a more harm reduction approach in general. In the youth engagement session, in the groups, youth talked a lot about having more comprehensive and integrated SED and mental health services, because often they're like not housed under the same agency, or so services often feel very fractured. They also talked about having more opportunities for peer-to-peer support connections, and generally moving away from a punitive approach, because again, this caused a lot of anxiety around reaching out for supports and asking questions when they wanted to. Youth also discussed having consistent preventive programming in schools, with generally more safe and inclusive spaces. And they also discussed how it's important to utilize social and functional incentives to empower youth. This could include health empowerment strategies, like having free or low-cost exercise classes, or employment-related strategies like professional development or access to professional wear, or workshops to help build out their resumes, and even housing support strategies. And they believe that having these supports in place could help them on their healing journey. This slide kind of synthesizes the data that we got from our school-based surveys. And schools are basically they just want to prioritize staff trainings, especially on topics that could help them identify the signs of use and the impact on health and wellness in general. Schools definitely talked a lot about collaborating with youth to understand their priorities, and they discussed how this could be done through advisory boards, and they could work with youth to kind of develop a plan to address needs. There is also a huge need for more licensed professionals with with experience related to substance use. And they also discussed how there is a need for more LADCs to have full-time positions in schools. Again, some of these themes are similar. There is a need for more preventive programming, especially as young as elementary school, and having very developmentally appropriate and factual psychoeducation, both for youth and for families. And there is a need to integrate social emotional learning skills and a more trauma-informed approach. Next, for recommendations, I'll kind of provide the key takeaways. We recommend that it's important to work with youth to develop pro-social and recreational activities that provide purpose and joy. Again, a need for early implementation of developmentally appropriate psychoeducation, more preventive programming. Families should be having more honest and objective conversations around their lived experiences and the impact of substance use, developing more opportunities for peer-to-peer connections and mentor opportunities, and also creating the ability to access education and services through apps, texts, e-flyers with QR codes. Another recommendation is to utilize more strength-based and family-focused and culturally responsive approaches, also to account for system-level factors such as structural racism, intergenerational trauma, and policies that might restrict access to education, employment, food, and housing. We should also be using storytelling as a prevention and intervention tool. And especially, it's important to bring in youth with lived experiences who have been successful in achieving their goals. And finally, we should be working with youth to understand what community means to them, as this could be a potential way to increase engagement and help with the dissemination of education. For policy recommendations, our data tells us that while decriminalization of substances for personal use is a good step, we should also be including increased access and expanded healthcare coverage to integrated and evidence-based care for both SUD and mental health, and also providing more professional training for staff. And finally, just to talk about what was challenging and what was exciting, I think that the current landscape of youth substance use needs is vast and incredibly complex, and has historically and is currently being influenced by many systems level factors. And I think navigating that space has been both challenging and exciting this summer. And I just really appreciate learning from everyone in the team, like Mark, Laura, Lexi, Jocelyn, and just learning to hear such diverse perspectives from the community members. I really appreciated their time and effort. But yeah.
Thank you so much, Sweta. Wonderful work this summer. Lots of great insights. Do we have questions from attendees or panelists for Sweta? Yeah, Tanisha.
Great job, Sweta. You talked about some of the preventative programs that should be co-created with youth. I just wondered if you had any examples off the top about what are some preventative programs that are in place, and what are some ideas that you think would be best for youth with SUD?
Mm-hmm. I know in our engagement sessions, parents and youth talked about having kind of creating more educational based content with youth, so that we can really understand what's developmentally appropriate for them, and also to talk a lot about the short-term impacts of substance use and not just the long-term impacts, because for a lot of youth, it's difficult for them to visualize the long-term consequences if it's not affecting them right now. And yeah, that's just something that came up a lot. And again, there was this one suggestion was to bring in trusted youths from the community to talk about their own experiences and the impact it has had on their own lives, and also to talk about how on their healing, like being on their healing journey has helped them achieve their goals and stay successful.
Great. One question we have, to what extent is funding for substance use for youth targeted towards treatment versus prevention? Can you kind of ballpark what that might be?
That's a really good question. There isn't a lot of information on this out there, but from what little I could find, most of it is based on treatment and not on prevention, which is something that has consistently come across as a major theme in our research and our engagement sessions, that there needs to be more preventive work. In the past, I know schools have had access to more funding to have some preventive programming or to have LADCs on site, but slowly over the years, the funding's kind of gone away. So the hope is with more advocacy, with more trainings, that might come back.
Sure. And then final thing, we have a comment, not a question, from Mark Sander, who was SWETA supervisor, who said, just wanted to say SWETA did an amazing job. It was a complex project with many different stakeholders and different types of info and data. Thanks, Mark. And thanks, SWETA. So our final presentation is from Melanie.
Yeah, let me share my screen. All right, can someone confirm we can see it?
I think we are actually seeing the presenter view as well.
Oh,
I know normally that doesn't happen, but
hang on one second.
that looks right.
Okay, I can't see the presenter view, but that's all right. I can kind of wing it. All right, so hi everyone. My name is Melanie Leopold. I worked with the strategic planning department this summer on the HRAP staff engagement project. So HRAP stands for Hennepin Resident Access Portal. And I am getting my Master of Public Policy at the Humphrey School. So here's a quick agenda. I'm just going to go over some background of what HRAP is, and then what I was working on, and then I'll go through my research design, results and recommendations, and then some learnings from the summer. So to give you all some background, I worked with, like I said, the strategic planning department with a lot of folks, but Jessica Centurino was my main contact and supervisor. So they are trying to solve a very big problem with the county that comes from siloed approach to delivery, inefficiencies and duplications for residents needing or requesting services, and then technology and systems that create barriers for accessing services. So before I got there, they did a lot of background research on this and came up with 3 goals. One is an integrated technology solution that shares data to connect where and how the county provides services. One is a foundation for an enterprise-wide resident-centered model of service delivery, including improved resident access to information, and finally, a structure for data collection and analysis that informs service needs and assists with reporting. So this is a really, really large project, and there's a lot of different things going on all at once. I came in to help with a staff engagement plan to ask staff what they would like to see from something like this. In parallel, they're also working on a community engagement plan, working with residents to see what their needs are. And then they're also working with the IT department at Hennepin County on prototyping the actual system. So my supervisor and I came up with the purpose statement for the staff engagement plan, which is the county needs information about staff and how they work in order to carry out the HRAP vision. And then the goal is for the summer was to develop an engagement plan and pass it off to the HRAP team for implementation. So one of the things that I worked on was coming up with a staff cohort model. So a lot of the other participants from this summer, the HUP researchers did a lot of qualitative research. And so the goal is for HRAP to do the same thing. So the staff engagement plan includes a staff cohort model that will be a part of each implementation phase of the project. So the first phase will have 6 focus groups to kind of get at the wider problems of what staff will need. And then there would be 2 focus groups each from these 3 departments that are the main targets of HRAP. And then there would be 1 focus group of frontline workers and 1 of mid-level managers or supervisors from each department, so that we were covering everyone. And then from those focus groups, the idea is for HRAP staff to ask for volunteers, 2 from each group, to commit some time over the next 2 years to be a part of the staff cohort. This will ensure that staff perspective is not overlooked and that they'll have input through the life of the project through these representatives. So this is kind of the larger research plan that we came up with. It's a lot of information. I'm not going to go super into detail, but I just wanted to give you all a high level overview. So like I mentioned before, there would be 5 different phases, and the idea is that these phases kind of walk through with where the rest of the project is. So like right now with the community engagement side, they're developing a survey and going out into the community to survey some folks. And so the phases 1 and 2 kind of line up with that, with the staff engagement. So to help HRAP focus on what staff needs, and then to eventually get more into depth and gather specifics. And then phases 3 through 5 are more in line with like the actual HRAP portal. So they're to be determined based on where this project goes. It's a pretty long project, probably a couple of years. So this will walk through the whole project. So yeah, I have different goals for each phase, and then key questions change with each phase as we get more in depth. And then I also developed a plan with different tools and methods that the HRAP team can use to do these focus groups and to do these activities. So I have a plan and a lot more detail and different activities that I'll pass off to the team. But I'll just go through the overall goals really quickly, and then I won't go into the super specifics on the methods. So for the first phase, we want to help HRAP focus on the most important aspects from the staff perspective. And then the second phase, gather more specifics about what they would really want from HRAP. And then for the third phase, we would want to learn the successes and failures of the current systems so that we can either keep whatever staff likes and then change where the problem issues are. And then with phase 4, we would understand exactly what staff users need from the HRAP system as it's being built. And with phase 5, we would determine what changes would need to be made to HRAP to make it user friendly. So after there's a prototype, staff users would test it out, and then we would make changes depending on what they find. So for results and recommendations for the staff engagement plan, the hope is that it will be implemented throughout the duration of the project with county staff. And like I said, this will ensure staff is involved in the HRAP project and that they have buy-in when the portal is finished and that they actually want to use it. We find that one of the issues is that staff can be often overlooked, and then a system is developed and it's not conducive for their work and it's difficult for them to use. So while community engagement is absolutely important, staff engagement is equally as important. And then my final product for this summer was the 5-phase staff engagement plan that can be implemented at any time. And the idea is that they will kind of shape and mold it as the project evolves. Yeah, and the last point is just that staff needs to be consulted as much as the community partners if HRAP is to be successful. So here are some of my learnings from the summer. The challenge is HRAP is a large project with a lot of complexities. It took me probably at least a month just to like wrap my head around what they're actually trying to do. It's really an important project, but it also just has so many moving pieces and parts that are happening at the same time. Some of the things I found exciting was researching different ways to facilitate focus groups. There's a lot of information out there, and I was able to do a lit review and find a lot of different resources that are really cool and different ways to engage focus groups than just like normal methods. I also learned a lot about community engagement. While I was working primarily on staff engagement, I also was able to sit in on all of the community engagement meetings and watch as they developed a survey and all the different steps they had to go through to get that approved. So that was really cool to learn about. And then just observing different processes that go into a really large county project. There's a lot of different stakeholders that need buy-in and just a lot of different review processes. So it was cool to learn about that. Surprises for me, the HRAP team's ability to work through issues. Government is complex and difficult to work within sometimes, and I was just really impressed with how they moved through things and their efficiency on working through things, especially like the community survey. And then just how well organized the team is and their project management skills. I learned a lot just from working with a lot of the different people on the team. And project management skills is something that I'm trying to develop, and it was just cool to watch different people and how they work differently and how you can take away whatever you want from them. And then my takeaways, I learned a lot about how county government works. And then just that qualitative research takes a lot of time and needs to go through many different approvals, especially at the county level. But it's super important, and I'm glad the detail and stuff that they're putting into the community engagement and hopefully the staff engagement. All right, any questions?
Thanks, Melanie. Great job. Any questions from attendees or from other panelists for Melanie? From your perspective, Melanie, what are the key success factors for this project?
I won't speak to HRAP as a whole because it's just so massive. There's a lot of different ones, but for staff engagement, I just really think making sure that they're involved in each step of the process, and making sure there's a lot of communication to the staff. I think change can be really scary, especially with a big system like this. So I think the key success will just be involving as many people as possible, and then making sure that they have buy-in and that we're really listening to what they need.
Thank you. Other questions from folks? Yeah, Denisha.
Great presentation, Melanie. I had a question about, you said you observed lots of project management skills and approaches from the team, and I was just wondering if you could share an example of what you observed.
So one of my favorite things that they did, they used a whiteboarding tool to facilitate just a team meeting pretty much weekly. So this was when they were trying to come up with the survey and also the community engagement cohort. And they used a whiteboarding tool to just kind of get everyone's input on the team up to what they thought would be important, and then organizing it that way. So that was cool. And then I got a lot of help with presentations and logistics on things and different tools that they use. So just learning how they organize their thoughts and present them to the sponsors at every step of the project.
I have one question, Melanie, which is how does this connect maybe with your future work or interests? What do you, I know you have and are currently working with the federal government. What are you taking away from this experience that might impact how you work in the future?
Yeah, so one of the things that I don't love about the federal government is I don't see the impact directly on the people just because we're at such a high level. And so it was really nice to see, especially in a big project like this, the team directly engaging with the community and doing that research that's needed for something to be successful. So that's one of my key takeaways, and something that I think I want to work on in the future is just like actually doing research with people, no matter what level of government or engagement you're at, I guess, if that makes sense. So yeah, I learned that I am more passionate about things if I can actually see the people it's touching and learn what they need instead of just kind of making assumptions.
Absolutely. Thanks so much, Melanie. Wonderful work. There are a couple of comments in the Q&A box that have compliments. Compliments are coming in for you and for all the students. I just want to say here at the end, a big thank you to all of our grad students. It is no small task to come into a big, complex county system and to get your bearings and to make a real contribution to work that is complex and ongoing in 3 months. So all of that, the students were able to navigate so well. We're really proud of them. I also just want to say thank you to all of the folks at the county that help us and the students do this work. I see many of the project supervisors in the participant list. Each of the students also had a mentor from the county who they were able to meet with separately from the project work and really think about their own kind of learning and development. So that was a really helpful gift for people to give their time in that way as well. Yeah, I thank you all so much. And we are excited to see where both your projects work continues in the future and the work that you will do in the community and in the academic world. Take care, everyone.
Thank you, Sarah and Scott, for everything, for your leadership this summer.
Thank you all.
Absolutely. Yeah,
Pleasure.
thanks, everyone.
Thank you.